And I think by some miracle of technology, that also means it's being broadcast on Facebook. Don't quote me, but according to Facebook, that's going to happen. So thanks again. I'm so grateful to see so many people here. Yay, thank you. Oh, look at it. Sorry, I can't stop and say like, oh, every single person, but it's really nice to see people here. I'm always so touched by how many people really care in our community, right? Like when we were first thinking about doing a trauma series, people were like, who's going to want to learn about that? Nobody's going to come. Nobody's going to want to like trauma. Don't call it trauma. But people have come, and every single time we get a great audience of people, and it feels so nice to have a community of people that care and care about each other and care enough to sort of look at things that are hard to look at. Sort of been the theme of the pandemic too, right? No autopilot for any of us. We really have had to stop and think and look at what's going on around us, even when we often don't want to. I'm really, really deeply honored to have Etel Haxhiaj here today. Etel is one of the deeply kindest people I've ever met. I like to consider Etel a good friend, but probably lots of people do, because that's who she is. She's unbelievably kind, and coupled with that, unbelievably brave, which is amazing and challenging to come by. She is very much willing to sort of look at what's happening for people and go there and see their pain and try to do something with it and try to do something about it. She's been a community organizer for much of her life. Even when she doesn't have that title, that's kind of the work she does. She's now the Director of Community Education. Is that the right title? Etel, at Central Mass Housing Alliance. We're super thrilled to have her here. She's, you also may have heard, she's also running for city council. So it's really exciting to have somebody who does this ground level work with people in need, wanting to have a seat on the council. Amazing. And she is joined by Brian Bickford, who I cannot firsthand say enough amazing things about, because turns out this is the first time I'm meeting Brian. And that in and of itself is shocking. I've had so many people say, how do you not know Brian? You do all this work with people with mental illness, homelessness, like so much intersection. And of course, another person who I've heard so many wonderful things about, and your reputation precedes you hugely, Brian Bickford. You are the person most people consider the expert, the local expert in this topic. So really, really grateful to have both of you here today. And as I said, Maura Mahoney's also here. She's going to kind of talk about some of the things the school does to support families who are homeless. We know that this is a problem that isn't one population. There's children, there's women, there's men, there's people with mental illness, people without mental illness. But I'm going to leave that to the experts to talk about. So again, welcome. If you haven't gotten a chance to introduce yourself in the chat, we would love you to. Again, we're recording. We hope that people will watch after. They will take questions. So Brian's going to be watching the chat. I'm going to be doing the slides. Etel's going to be talking us through them. So just kind of let us know if something comes up and you have a comment or a question. We're really grateful that so far today we have electricity and like everything seems so far so good. So I am going to share the deck.
Great. Thank you so much, Amy. Always so kind and loving with your words. And I'm very grateful to have been invited. And in my, the most important title that I hold is the mom of two boys, and bring that experience as a mother to the work. And by no means am I an expert, have never experienced being homeless or having had the experience of losing a home and being unstable. but I have experienced the struggle of being displaced as a result of war in my native country. So I have that kind of experience that have shaped why this topic is so important to me. So I am grateful that all of you are tuning in to listen, and hopefully this information just helps us have a conversation and most importantly, move the conversation forward in the community as to why family homelessness is so important. And thank you, Amy, for helping me advance the slides.
You might have spoken too soon. Oh, wait. All right, there we go. Yay.
Okay. So just to give you a little bit of background, Central Mass Housing Alliance leads a collaborative response to homelessness with the vision for long-term housing stability through prevention, quality services, education, and advocacy. I'm very lucky to be working in the field of or leading the community education and public advocacy program. We are the family shelter provider contracted through the Department of Housing and Community Development to provide emergency shelter for families with children and pregnant persons. We are the lead agency for the City of Worcester and Worcester County Continuum of Care. And then we support the community through different ways: eviction prevention, obviously a spotlight given the COVID-19 crisis, elder home repair, donations clearinghouse, Hope for Housing, as well as public education and advocacy. I do want to say that prior to coming to this position, which will now be a year next month, I did work for 3 years in one of our family homeless shelters, which was an experience that has deeply impacted and informed how I view this topic. Okay, next, please. I wanted to share with you just a few stories or just a few things that have come in my inbox during this crisis. I have not included, obviously, the names of the folks, but as you can see here up on top, a mom contacted me saying, I have 4 kids. The 2-year-old is disabled. The 11-year-old is special needs. I have severe mental health issues. We're homeless, live in a homeless shelter. It's rough in the pandemic. She was looking for housing, and not just, temporary housing, permanent housing, which for those of us working in the field is something that we want to find for all of our families and anybody experiencing homelessness. This mom who contacted me was from a different area than Worcester, which shows you that people are really, really desperate right now. A couple of other emails that I received, obviously you can see the desperation. Obviously you can see that these are moms and dads and others, caregivers with children that are not only facing eviction, but have been impacted even before the crisis by the experience of homelessness. Next slide, please. I'm not going to read through this, but I wanted to give you a quick idea. The definition of family homelessness can get very, very confusing. Those of you who work in the field know this. There's different definitions from the Department of Housing and Urban Development to state to McKinney-Vento. But in general, there are 4 broad categories of homelessness that define who is eligible for services, especially in the family shelter world. It's folks usually who are living in places not meant for human habitation, emergency shelters, transitional housing, or exiting from other institutions. People who essentially do not have a long-time primary nighttime residence, which could include anyone living in a motel, hotel, doubled-up situation, which we know it doesn't get counted mostly in the point in time count that the federal government charges us to do. And I'm sure Maura Mahoney will talk about that as well. Folks that, families with children or unaccompanied youth who are unstably housed, likely to live in that state, who do not have any residence, do not have a lease, or do not have an ownership interest in the housing units, and that have been consistently on the move. And this definition also includes and was expanded to include folks that are attempting to flee or fleeing domestic violence, dating violence, sexual assault, stalking, or other dangerous and life-threatening situations. Just wanted to give everybody a quick overview of some data. Obviously, Homelessness touches everyone, like Amy mentioned in the beginning. There's many more subcategories that are not included here. But just to give you a quick overview, in Massachusetts, the 2019 point in time, it's a snapshot in one night in January that the federal government wants us to capture for families and individuals that live in shelters and aren't sheltered. And I'm sure Brian will talk a little bit more about that. But as you can see, in 2019 point in time, 3,766 households, these are families with children, live in emergency shelters, transitional housing, or are in shelters. What that translates to is 12,212 people, and of whom 7,326 are children under the age of 18 years old. In comparison, the Worcester County point in time, this is not data that's published yet, so I'm sharing only here partly because I wanted to give folks a snapshot in time of what this looks for us in Worcester County. 861 homeless households live in emergency shelter, transitional housing, safe haven, or are unsheltered. So that translates in 250 households with at least one adult and one child. So we're talking about those families. And in that category of those households, 471 folks are under the age of 18. So that means we have 471 children under the age of 18. It's important to talk about the racial and ethnic breakdown because we cannot look at homelessness without looking at it from a inequity perspective and how race and ethnicity factors into it, but specifically race. So you can see here for sheltered and unsheltered total. So these were adults and children. The total number is 773. You can see the breakdown, 565 white, 185 Black or African American, and so on. In terms of ethnicity background, you'll see that it's broken down by Hispanic and Latino. These are all categories that the federal government has prescribed to us, 406, non-Hispanic, non-Latino, 367. Now, I took a look at the US Census Bureau to sort of give you an idea proportionally how race factors into it. And you can see that for white alone, this is from 2019, 85.7% of the population. Whereas here you can see that 73% of the homeless folks are white. Black or African American, 6.1% of the population, yet Black and African American or African American are at 24% disproportionately represented here. Hispanic or Latino, they make up 12.2% of the population, yet they're represented at 52.5% of the homeless population. In Worcester County, families with children make up the largest number of people who experience homelessness. So out of 861 households that experience homelessness, 29% or 251 are families. And out of 1,041 persons total who experience homelessness, we're talking about Worcester County, 51.1% or 773 are persons living in households with one adult and one child. This is something that actually I ran into. I had no idea this study had been done in Worcester. So as I was gathering some research for this project, this really struck out for me. And I've included some sources if you wanted to take a look. But apparently in 1990, or it's called the 1993 study, there was a Worcester Family Research Project done to take an in-depth look at the realities of family homelessness. So this blurb here describes some of the goals of this study, which was to examine the risk and protective factors associated with family homelessness and to assess the needs of homeless and low-income house families. So definition of the family study that was used here was single parent, female-headed households, and dependent children. At the time, such families represented approximately 95% of the homeless family population in Massachusetts. 220 sheltered homeless families were enrolled in 9 family shelters in Worcester. And that subgroup was compared with 260 low-income families that had never been homeless, but were receiving aid for families with dependent children. So participants were interviewed at the time of enrollment in the study, as well as 12 months and then 24 months later. So you can see there, 220 mothers, 350 homeless children, and then the comparative group was 216 female-headed household families. So 216 women, 350 children. You can see the racial breakdown there, 36% Puerto Rican, 35% white, 12.5% African-American, 6% other Latina, and the remainder were mixed ethnicity. When you get these slides, I've included the sources for all of these, so you can take a look at it. I didn't mention the fact that I wanted to focus on family homelessness, but specifically the fact that here and in all the studies, we know that female-headed households are one of the leading numbers that we have in our family shelters, and that's important because later in the presentation you'll see some of the trauma-related aspects of that mothers experiencing homelessness and their children are subjected to. Slide, please. I wanted to give you a quick idea of what this study found. The study found that the majority of families were composed of single moms with 2 young children, often under the age of 6. These families tended to be residentially unstable, not having stable housing, something that we see in our community and others, moving frequently, often living in substandard housing. I wanted to include that piece about substandard housing because those of us that have worked with families know that it's not just a matter of finding housing. We know that substandard housing contributes to health and safety. What we mean by substandard housing, usually it's housing that has mold, it's not well insulated, the appliances are not working. Often families are pushed into substandard housing because those tend to be cheaper, and they are sometimes run by slum landlords. And it's an important factor to always mention that just because there's housing available doesn't mean that it's suited for families or anyone in that matter. Everyone deserves dignity and safe housing. Some of the other studies found, or some of the other findings, were that there were low levels of education. Many moms were unable to find jobs that paid livable wages. This is not something, this was done in 1993, the study. You could easily replicate all of these findings today. We have many folks in the community that cannot find livable wages, 15 an hour. It's not a livable wage, despite what people say. It's still a poverty wage. And there's many, many folks that are still not even reaching that 15 an hour. Transportation, adequate childcare, huge factors. Obviously, conversation that's happening in the community right now about public transit, as well as adequate and safe healthcare, childcare. A shockingly high number of mothers experience interpersonal and family violence, often witnessed or directly experienced by their children. We know that domestic violence is a huge leading cause of homelessness. And you'll see in the slides, some of the data will show that as well. And goes without saying that all of these things obviously lead to high rates of major depressive disorders. And how can they not? If you're dealing with the trauma of moving, not being able to protect your kids, trying to find housing, the trauma of racial disparity, discrimination, all of those things that compound the trauma experienced by folks that are going through this crisis. Okay, we can go to the next slide. This was from a report. It's a really interesting report that was done in 1994. It's called America's Youngest Outcast, the Child Homelessness Report Card. And it was done in 1994. I haven't seen an updated version of this. If any of you know of it and can send it to me, that'd be great. But just gives you kind of like a report card and a bird's eye view of what Massachusetts looks like. You can see from 2010 to 2013, when the study was done, there was an increase in child homelessness. Massachusetts ranks 18. This was a study of all states. It gives you an idea of risk for child homelessness. So foreclosures, children living in poverty, children without health insurance. Obviously, this was done in 1994. I'm sorry, this was done in 2014. But 6 years later, we all know that these are issues and topics that haven't changed, and the disparities have gotten bigger. So this kind of gives you an idea about all these things. There's things about health problems with children living below 100% of the poverty line. Food insecurity, huge topic, not only just during COVID, it always was a problem, just COVID has exacerbated and brought all those things to the surface. And there's some statistics there about education proficiency. Okay, we can move to the next slide. This is not in particular order, but I wanted to sort of gather some of the systemic factors that lead in our cause of homelessness. So talked about domestic, sexual, and dating violence often forces households and parents and partners to lose their housing. There's a huge income housing gap. We talked about poverty wages, the high cost of housing, oftentimes substandard housing. People are simply just not able to narrow that gap. Obviously, racial disparities goes without saying, interwoven in all of these categories. The lack of truly affordable housing and deep subsidies. Those of us that are trying and have worked in this field for a long time, I see Parley Jones in there as well. She'll tell you, and other folks who've been working in this field, is that it's not just that housing is not affordable, it's that for a lot of folks, a lot of folks are also struggling with subsidies. These are folks who are struggling with disability, are on Social Security income. Just simply affordable housing is not enough. It's literally not possible for them to maintain unless they came with deep subsidies. There's also the stigma and lack of access to mental health and substance abuse treatments, whether that's in shelters or outside of shelters. And there's many more. Okay. What was gleaning for me for this study that was done, that was cited in America's Youngest Outcast, is that there was a Dr. Basuk, who led this study, had a quote in there that really spoke to me and said, family homelessness is exploding because of the demographics of the family have changed. There's a rise in female-headed households and poverty, an expansion of the low-wage economy, lack of affordable housing, increased levels of violence against women, and cuts in human service programs. Family homelessness consolidates all of our society's gender issues in one place. And I would add to that also racial issues. Gender and race always intersect in all of these issues. This was a study that was done, again, if you're able to go to this source and just read it, it's really fascinating because a lot of this also took place in Worcester. Okay, we can move on to the next slide. So some of the things that I wanted to highlight is the studies of mothers experiencing homelessness. There was a wave of these studies besides the one that was cited here, documented that 92% of homeless mothers have experienced some form of physical or sexual assault over the course of their lives. And this mostly happened in familiar or intimate relationships. That violence carries over into adulthood, with 63% of homeless moms reporting severe physical assault by an intimate male partner. And then homeless moms, all obviously for all these reasons, suffer poor health than the general population. And access to good, affordable health is also a huge factor. Okay, we can move to the next slide. Wanted to pull out some of the physical and mental health strains that homeless moms experience. You can see here I've highlighted high rates of mental health and substance abuse issues. More than 1/3 of moms who are homeless have chronic physical health conditions. We know that if you're dealing with so much stress, toxic stress, it's constant. It takes a toll on your body, especially if you are a single parent. More than 1/3 to 1/2 of homeless moms have experienced PTSD, a rate 3 or more times higher or greater than among women in general population. And then 85% of homeless moms report a history of major depression. It says, given high rates of violence and mental health issues, obviously a lot of moms or women that are homeless also have experienced twice the rate of drug and alcohol dependence as a general population. Brings us to the question of what about children, right? We can't talk about families and parents and grandparents and caretakers without talking about the trauma that this takes on children. The National Center on Family Homelessness has some good reports on this, and some of the statistics that I pulled out of there really staggering. Within a single year, 97% of children who are homeless move up to 3 times. If you are a child and you're having to consistently move from place to place, where away from social networks, having to make new peers, also struggling with food insecurity and learning opportunities, how can this not take a toll on you? 40% attend 2 different schools, 28% attend 3 or more different schools. Just the trauma of having to move from place to place to place as a child, I think is enough to just make us pause about the impact that even for children in our own community in Worcester Public Schools, which I'm sure Maura will talk about, the impact that has on families and kids. Nearly 1/4 of children who are homeless have witnessed acts of violence within their families, obviously significantly higher rate than children in the general population. We talked about the trauma of domestic violence and a lot of those things, don't happen in vacuum. And so children that witness that trauma are re-traumatized when they're also moved from place to place to place. Obviously, how can you not worry as a kid whether you'll have a place to live or you'll have a place to sleep? A lot of kids carry that fear that something bad will happen to families, especially if they end up being displaced and going from shelter to shelter or home to home. Again, we have to keep in mind that the numbers of doubled up families and kids are not always reported, they're underreported. There's also a lot of stigma with saying and disclosing that you are someone who's experiencing homelessness. Okay, next slide. Some other statistics, we know that more than 1/3 of children who are homeless have been the subject of child protection investigations. 22% are separated from their families, and then 12% who are homeless also placed in foster care. Now, how this breaks my heart, because not only have we know that there are kids who don't have a place to call home on a consistent basis, starting from their early childhood. But we know that parents are under such enormous stress. And you saw some of the statistics previously about especially moms struggling with mental health or substance abuse as a result of the trauma and stress of having to find a home. And so oftentimes child protection services are brought in and separate kids. And I don't have statistics, but I'm sure there are plenty out there about the racial and ethnic background. I am sure that plays also a huge role in who gets mostly separated by race and ethnicity. And so, just to get a sense of the enormous compounded episodes of trauma that kids experience in early childhood. Okay, we can move on to the next one. Homelessness often starts in childhood. Some of you might be familiar with the adverse childhood experiences in the homeless in general, but studies do show that higher prevalence of ACE in the homeless community. And if we can move to the next slide. So I found this really heartbreaking statistics and graph about how this relates to adult homelessness, how ACE, which, to give background, the term ACE is used to refer to potentially traumatic events that can have lasting negative effects on health and well-being. So some examples include emotional abuse, emotional neglect, household mental illness, parental separation, and household substance abuse, among others. So what this infograph shows to you is that as childhood adverse effects increase, so does the likelihood of an adult experiencing homelessness. And so if kids are experiencing these traumatic events from early on for no fault of their own or their parents, you can imagine that as they grow up, their chances of experiencing homelessness as adults get higher and higher. And obviously, I know in all of the slides that we're going through, I want all of us to keep in mind that race is an I'm probably not saying the right words, so somebody who's more articulate than me can say, but what I want to say is that it's a thread that goes through all of these things. These are not things that happen in vacuum. They're not divorced from race or poverty. They're all interrelated. So I just want us to keep that in mind. But yeah, this is a heartbreaking, just graph. And it really, it just underscores for me, especially for those of us who work with children or have been youth workers or work in the schools, that, even when kids don't they don't divulge that they're experiencing homelessness as their families. Like, you can just imagine the extreme trauma that a lot of our kids in our schools or in our community are experiencing that we may not know, right? This is often an invisible, it's just an invisible trauma they carry. And so, as a former youth worker, I worked with a lot of families that were really unstable housing. And it's very traumatic for the kids. They're consumed by how their families are struggling and how to help them. And that's not a way for a kid to live their childhood. All right, I digress. We can move on to the next one.
I think that is really an important point to bring home. And that's been, one of my biggest learnings about trauma is people that already are suffering get the furthest marginalized. You can really see that playing out here. And just trying to think about, if you're a parent or if you're struggling with your mental health, how are you going to make improvements if you do not have the stability of a place to live? It's so striking to me. I also, while we were doing this, Lori Ross is on the call, but she can't talk, but she texted me that 93 study that you referred to, she was, as a student, part of doing that work. And the stories she heard impacted her through her whole life. Like, she really defined her career around what she saw in that study. So it's a little bit of a mind blower, and also sort of this coming around of when you see how much this is hurting people, we hope people feel compelled to do something to help.
Yeah, it's definitely collecting these numbers together in one place. It just really reiterated for me how we talk, like, right, our circle of folks that work in the homelessness world, we talk about family homelessness because we do the work. And those that have been doing it longer than me have talked for a longer time, but we need to bring these conversations out in the public realm, onto the city council floor, onto conversations, because family homelessness goes really invisible for a lot of communities, including ours.
Excuse me, Etel, can you hear me?
Yes,
Hi, this is Wahaya, and I try to speak out when I can, but I just get so emotionally charged. I get angry because I'm out there, but I'm out there as a grandma, seeing like, oh my goodness, to me, these like millennials are kids to me. And then I feel about for their parents, and I'm hearing their stories about not being able to get their kids back. Everyone, no housing. DCF wants the housing. And I'm like, I'm guessing you want them to have a job to pay for it, because no one's given second chances. So, and it costs me and my daughter $500 in application fees to be turned down. So it's very hard. It's so expensive to try to get out of homelessness. And the stuff I've seen, these young kids are talking to me, they're crying on my shoulder, and it's just affecting me, because I have, my heart is as a grandmother, that's the first thing. So I just want to thank you also for putting this presentation out, because people do need to hear it. And I've got quite a few people that want to talk somewhere, because they are so angry like me. So, but thank you.
And thank you, Wahaya. I know that this is especially personal to you, and I've followed your story. And you know, you always say that getting out of homelessness is expensive, and you know that's something that we all need to keep in mind. The getting out of it is not easy. So I appreciate you sharing.
Okay, thank you. Thank you. I didn't mean to ramble on, but thank you.
No, this is important.
All right.
I am not. Is there a way to the chat box keeps popping up and oh no, it's actually good. I figured out how to do it. Okay. So I'm sorry to those of you that are engaging in the chat that I'm not able to follow it. So if it's okay, we have somebody that's following the chat, right?
Yes, so I am paying attention to the chat just so everyone knows if there are direct questions. I will definitely stop Etel, but if not, then folks can just kind of look through this. And if you have something you'd like to say, just definitely let me know, and I'll stop Etel.
Thank you, Brian. I just wanted to bring some numbers here for the Department of Housing and Community Development, which is the state's entity that contracts shelters for family emergency shelters. And so these were some numbers from June 2020, their monthly report. As you can see, in just the last year, 5,873 families applied for emergency shelter. That's including hotels, motels, and home base, which is a program for emergency shelter eligible families that exit shelter and they get subsidies for about a year, for 12 months. Out of this, 363 families with children entered the emergency shelter system. Obviously, this doesn't include, it's not reflective, what I want to say, of the need that's out there. I pulled out some statistics out of this to give you an idea. 40% of families that applied for shelter, this also includes pregnant persons, 40% were as a result of irregular housing situations, 19% were due to domestic violence, 14% due to living in places not meant for human habitation. So the way that that's defined, in anyone living at an emergency room, in a car, in a park, on a bench, those are considered places not meant for human habitation. And then 6% was due to eviction or actually eviction or threats, which becomes super relevant in the time that we live today, in the time of COVID. Okay, next slide, please. Hard to see kind of this graph, but what I wanted to pull out of this graph is the number of kids. So a total of 6,826 children live in the emergency shelter system in FY20. So 23% are 5 to 8 year old, 22% 0 to 2 years old, and then 14% 3 to 4 years old. I mean, I just want to leave this for a second so we can absorb these numbers. 6,000 children. And again, this number is not reflective of the real picture of homelessness. But the fact that we have infants and 5 to 8 years old and 3 to 4 years old, like the ages that are not even yet in school or like just starting school, it's just really heartbreaking in a state that, anyway, I'm not going to go there. So that's just a snapshot. So when we see those numbers, right, the question that, at least for me, and I know for a lot of you or all of you on the call, is what repercussions does then homelessness have on children? Well, mental health issues that we see at the beginning of the presentation, the high rates of depression seen in homeless moms, significantly then prohibits a parent from really truly bonding with their child or responding to their needs, not because they're bad parents, not because they don't care about their children. It's because the trauma of homelessness consumes one. As a consequence, then, we have children who are homeless who also present with developmental delays, physical and emotional health challenges. Again, these are not children that are not able, they're not, they're children that their emotional well-being and their developmental well-being is affected by their parents living in trauma and the fact of moving from place to place. Rafferty and Shin are two researchers who have done studies of children who are homeless and have documented the developmental delays, difficulties with attention, speech delays, immature peer interaction, language disabilities, and cognitive delays. And then her colleagues, Basuk and her colleagues, also noted that children who are homeless also demonstrated significant delays in language development, all the gross motor skills, fine motor skills, social personal growth, and then more than half of the homeless preschoolers showed at least one major developmental lag. So if homelessness begins in childhood and children are already, their well-being and their growth is being impeded and directly affected by their parents and themselves experiencing homelessness, you can imagine that when you go back to the graphic that I showed on the adverse childhood experiences, how that can translate into adultness, into adulthood and school learning and gaining the skills necessary, for example, to go to college and make a life, so just some more data around how this affects our kids. Okay, we can move on to the next slide. This is also another statistic about connecting homelessness and poverty and medical care. So children who are homeless and families living in poverty lack routine and timely medical care. That includes dental care. They often have poor nutrition associated with lack of money to provide adequate meals. We're talking a lot in our community now about food insecurity. One of my colleagues recently shared with me that in the home-based program, she and her staff actually went during the holiday season to distribute some gift cards to the families. And, it just broke her heart that some of the families were really, truly struggling with putting food on the table. Even with the subsidies that the state provides, which are definitely not enough, we really are dealing with the crisis in our hands that affects elementary things like as having enough food or nutritious food on the table. There's a consistent lack of healthcare prior to and while homeless, combined with the stress of homelessness itself. It's a leading contributor to poor health. And then nearly 70% of infants, toddlers, and preschoolers who are homeless have chronic illnesses. In Worcester, for example, we do have a high rate of pediatric asthma, not noted in here, but that also affects disproportionately African American and Latinx children. So those are just some of the heartbreaking statistics again of how homelessness affects our children. Okay, we can go back. I wanted to give you a quick, my colleagues, who is a doctor in Boston, she put this graph for a legislative briefing at the Boston Children's Hospital. She's a medical professional, and we don't have the statistics for Worcester, but this shows you the departmental visits by children in homelessness, homeless kids, January through September. Sometimes what happens, those of us who have helped families and have worked with families and kids know that sometimes families literally go to the ER to be able to qualify for shelter, because that's just the threshold that many of them or all of them need to meet, is that you need to be able to live in a place not meant for human habitation, and an emergency room. It's not a place to live. But this also shows that a lot of the kids that she said she's seeing and parents really go there because they really have no place else to go. And during the pandemic, that also became quite a bit of an issue. Okay, we can go to the next one. So one of the things that we know about poverty and homelessness, as well as any other type of trauma, is that it affects the brain. It affects our executive functioning. It affects how we think about meeting our goals, doing our daily tasks. And for folks who live in poverty and constant toxic stress, it literally changes your brain. Science also shows that it changes the brain of fetuses in a mother's womb. If mom is experiencing a lot of toxic stress, that stress transmits to her child as well, to her unborn child. So I just wanted to put this as just another way to show how for children who grow up and remain in poverty, they're doubly affected, obviously. The section of the brain in question is also known to be particularly plastic. meaning that it can be strengthened and improved well in adulthood. So all hope is not lost, and obviously children are resilient, but it's important to acknowledge that the amount and the compounding of trauma from homelessness, poverty, and racial inequalities, fear of not having a place to live, it affects the brain, it affects how people think and function. So it's important for us to keep that in mind. Next slide, please. I put this slide in here because oftentimes people think that, well, just because somebody lives in shelter, that somehow this is, that the sort of the, at least they have a place. And that's true. It's good that we can have shelter for folks who, with children, so they don't have to live outside and in places not meant for human habitation. But entering shelter is also a stressful experience. Shelters are usually old buildings. You share a room with someone, or you have a room with your family, you share spaces, and they're not places ideal for families to live. And sometimes folks who enter shelter, or all the time, I would say, they are already coming in with a lot of trauma in them. And so I wanted to kind of bring that into perspective, that for families that enter shelter, they've already experienced some sort of trauma, so sexual assault, domestic violence, eviction, loss of a job. Entering shelters is traumatic. Displacement from place to place causes a lot of stress. Families are away from their community of origin, which then cuts their connections to their social networks, which makes it even 10 times harder to go to a foreign community and having to start from scratch. Children have to change schools. They have to get accustomed to new environments. And also being in a shelter has rules, regulations, and it can be limited. You share space with other people. You're bound by rules, sometimes can be punitive. There's lack of privacy. And especially in the time of COVID, we know that for congregate shelters, the risk of infection was also even higher because people live in such proximity. I can tell you that my colleagues who run our family homeless shelters also, were so incredibly sad and trying their best to really keep families as much as possible to juggle the stress of being cooped up in one room, for example, in one apartment, not having the time to go, not having the ability to go outside for their kids, while also juggling remote learning, which I have a privilege of living in a place where I can move around the house and my kids have a space to go outside, but I cannot imagine what would be for a family that's also trying to figure out their housing situation to manage all those stressors. Okay, we can move on to the next one. This is just a reiteration of what I was saying before, that families are displaced and that experience homelessness lose their social and community connections. I mean, we're all experiencing some type of community, like our social, missing our social connections. So you can imagine having to experience this on a regular basis. I had this quote from the European Federation of National Organizations working with homelessness that spoke to me as well. It says that, like other traumas, becoming homeless frequently renders people unable to control their daily lives. Social exclusion activates the same neurological systems as physical trauma, with a similar impact on people. And that's something that I'd heard a lot from some of the families that I worked with during my time at the shelters, that you feel out of control, like you don't have control over anything. It's somehow everything is dependent on other people, access to resources and finding housing and a landlord that likes you, a landlord that doesn't discriminate, etc. As well as I was saying that the stress of losing a home, caring for children, while looking for stable housing and jobs compounds that level of stress that families feel. The trauma of racism Black and brown families experience adds to the homeless experience. All right, we can move on to the next one. I'm not sure, Amy, how am I doing with time? I think I have a few more slides left and then.
I think you're doing fine. It's not an hour yet. So you still have a good, more than an hour for Brian and Maura and questions.
Awesome. Okay, I wanted to show you folks a slide that my colleague from Central West Justice Center, Liz Alfred, had done for another presentation. This is a housing court summary process for cases filed in November 2020. According to the trial records or the eviction dashboard, there were 2,771 new summary process cases filed in November 2020. So these are sort of pre-eviction notices for folks that, this was back in 2020, right? So numbers we're probably going to get are way higher, also because the eviction moratorium that the CDC issued will end in March of 31st of this year. How this connects to also, it's been interesting to see that the entry into the family shelter system has also been low, right? So for months, entries into the emergency shelter system have been 40% lower than last year. We suspect that this is partly because the eviction moratorium that was in place when Massachusetts issued it also created an effect where for families living in shelter, they were having a hard time finding apartments because for a lot of reasons, but partly because there was a really low vacancy rate. Nobody was moving, in other words. Also, we know that some units were left unfilled to count for sort of decongregating shelters for those shelters that had needed to leave aside units to protect folks or to isolate folks who contracted COVID. So that led to less units for folks. And in general, it's been really hard to get through the family system through DHCD, only because right now, the only way that someone could apply for shelter is literally through the phone, and there's no other way. So that has all led to a 40% less entry into shelter than last year, which makes you think about where then our families going. Where families are going, we suspect, is they're doubled up, they're moving from couch to couch, they're in situations that are not healthy. And some of my colleagues will attest to, there's a ton of families that are falling through the cracks because if they cannot access family emergency shelter, the options are literally slim, which forces folks into more unsafe situations. So stressors during COVID-19, obviously navigating the court system. If you're a family that's facing eviction, just the mere fact of having to appear in court in Zoom when not everyone has the technology, it's extremely intimidating. Just the idea that someone who's maybe has lost their jobs or is struggling with the kids at home, remote learning, having to also appear in court because they're about to get evicted. I mean, just imagine the stress of that. Obviously, not a new thing for our community or others, that there's an ability to find new and affordable housing or access and shelter, as I mentioned. And again, not just affordable housing, truly affordable, but also safe and healthy housing. Obviously, the stress of caring for children while remote learning, in our shelters, we did our best, and the Worcester Public Schools has been super helpful to get our kids hotspots, but sometimes, you have to go through the window to try to get the right spot, and it doesn't work there and it doesn't work there. Imagine if you're a single parent stuck in a room literally with 3 kids or 2 kids, and having to manage all of your belongings in one space and all of the kids needing room to learn and to manage remote learning, how difficult that is and how stressful that is. And obviously we have seen that RAFT was not meant to be a disaster relief program, yet it has been sort of the burden has been put on a lot of workers to try to make it a disaster relief program. And that program is under a lot of strain, hasn't met the need of the community, not because we're not working hard enough. It is because the need is such that we need more sustained and rental assistance in bigger numbers over a long period of time. This is not going away anytime soon. Okay, next slide, please. I wanted to bring this report that was done by the National Low Income Housing Coalition. It's called Out of Reach. And I pulled out the numbers from Worcester, Out of Reach Worcester, right? A lot of us would agree that for a lot of working families, but specifically also for a lot of families experiencing homelessness, it's become more and more out of reach. So here's some numbers from that report. Worcester remains out of reach for many renters and essential workers. I'm going to pause there for a second, because what this crisis has shown us is that, yes, homeowners absolutely have been vulnerable, but renters and essential workers tend to work multiple jobs. They tend to work lower paying jobs. Essential workers tend to be low income immigrants, refugees, Black and brown workers that are getting paid, that 15 wage gap jobs. And so you put all of those things together with the housing market that's becoming more out of reach, and you can see how all those things compounded could lead to an increased number of folks at imminent risk for homelessness. So the fair market rent for a 2-bedroom apartment in Worcester County, in Worcester County, it's $1,398. So in order to afford this rent and utilities without paying more than 30% of your income, a household needs to earn $26.88 per hour. And it's important to mention here that folks are not just struggling with paying rent, they're struggling to pay for utilities. Now that we have the kids at home, it's frigid outside. And so if you're lucky to live in a place that you call your own, you're spending not just on rent, you're spending on electricity, you're spending on heat, you're spending on internet, and food. So, right. So it's not just, I get really upset when people just mention rent, because that's not the whole picture of what a family struggles to pay. So it's important to keep these numbers in mind. The average wage of renters in Worcester and surrounding areas is only $14 an hour. So you need to earn $26 an hour to afford a rent of a 2-bedroom apartment, sorry. And then in order to afford a modest 2-bedroom apartment in Worcester at the average rate, renter wage of $14, a renter would need to work 76 hours a week. That's 52 weeks per year. So let that sink in. That's 76 hours per week. Now, if you fall into this category and you're also talking about the fear of losing your home, and you have small children and they're picking up on your stress and they're worrying, where is mom, where is dad, where is the caretaker, the caregiver, how we're paying rent, like the trauma and the stress that kids are experiencing, not just kids that are experiencing homelessness, but kids that are right on the verge of becoming homeless. It shows you the amount of trauma that our community is experiencing. Okay, we can move next. I'm almost done here. I wanted to bring up this issue because it feels important to me too. The Out of Reach report also paints a stark picture of wage inequality for essential workers. So the largest number of frontline workers, predominantly people of color, work as home health and personal care aides. They make an hourly median wage of $15 an hour. Close behind them, you got retail workers, median wage is $13 an hour, fast food and counter workers who make $12 an hour. So essentially, as household earning these wages would not be able to afford a simple 2-bedroom apartment in Worcester or surrounding towns based on the income and the wages that they bring. This is the end of my presentation. It will really take all of us to eradicate family homelessness and homelessness for everybody. Obviously, we need a lot of federal, state, and local policymaking and legislation that puts families with children, housing and income stability first, and that we do so with an equity lens, cannot go unsaid. All right, I am gonna pause here and take a gulp of coffee. Thank you everybody for being so attentive. And I'm sorry I missed the chat.
You need a gulp. That's so much stuff and so Definitely appreciate all the data that you put together for this and the local nature of this data. It certainly lines up with what we've been doing and saying all along. Trauma really compounds itself. Once one of these things happens to marginalize you or your family, it just kind of keeps going. You really also showed there's not a lot of super easy solutions. It's complex. I haven't looked at the chat either, but I'm thinking maybe Maura, do you want to jump in and talk a little bit about what you see in the schools? I know the school has a whole team of people that try to help when a family's up against this.
Thank you. Yes, just some, I want to thank everybody for coming today and also for giving me the opportunity to climb on my soapbox, my McKinney-Vento soapbox. I am the manager of social emotional learning for the district, and as part of that role is that I'm the liaison for the district with DESE. For those of you who don't know what McKinney-Vento is, it's the federal legislation that provides support and services and financial support as well for families that are homeless. Currently, I'll start with some numbers. And one of the things that a couple of years ago, there was a report that came out that Worcester had like the outrageously high number of homeless. And I did some digging because it didn't line up with the numbers that we had. What I realized pretty quickly was that the number that was provided, which is over 3,000 a year, is students who at any point in time during the school year were homeless, which is different than I was able to look up just today. Today in Worcester Public Schools, there are 2,300 students who meet the McKinney, which is outrageous. I can just tell from Amy's face that it's pretty shocking. And not to be Debbie Downer, but those are students that we know of. I think the number is very much underreported. As of the middle of January, we had there were 1,934 sort of currently registered students. I mean, there had been 1934 over the course of the year. At that point in time, there were 401 living in shelters, which would be the shelters in Worcester, as well as some of the apartments that are, like they're transitional. So they're considered part of the shelter system. We have the biggest number, and again, I think this is the one that is woefully underreported, are the doubled up students. So doubled up is when a family is sharing housing of another. I'm just reading this from the federal because, as Etel said, there's different definitions of homelessness, but these are the ones that we use from the school. So sharing of other person's housing due to a loss of housing, which could be an eviction. This is the time of year we have, and I know these numbers are low because we've had probably a dozen kids in the last month and a half who had to leave their housing because of fire or because of the pipes burst when it's freezing cold. And those kids aren't always flagged right away. Economic hardship, living in a hotel, motel, a trailer park, or campground. In Worcester, we don't have a lot of the trailer park or campground situations. However, just outside of the city, in our less urban, more rural districts, there's a pretty significant number. So there are families who are living in a campground from, say, April till October or November, who then really don't have a place to go. It's really important to understand that it's for economic reasons. It's not that, Amy's my friend and I'm building my dream home, so me and my kids are going to move in with her and her kids until my house gets built. It's when I show up at Amy's doorstep with my kids and my bags and say, we have no place to go. So part of the conversation that we have, that I tell my staff to have, is when you find out that children are living with, and it's typically a grandparent or not an uncle, I said, the question that I ask is, oh, are you living with grandma or is grandma living with you? So if grandma's living with the family because maybe she needs some help or she's got medical issues, that's not homeless. If you're living with grandma because you can't go anywhere else, then you are homeless. So again, the doubled up, the unsheltered, which would be the families that are living in their cars. We have 9 students, unaccompanied youth. So that would be the kids who are, referred to sort of as the couch surfers, that maybe, they tend to be old. They're primarily high school students, usually junior, senior, oftentimes over age. So they may get kicked out from their families. So they're, the phrase is couch surfing, which is really what it is. They're staying with one set of friends, one friend's family for a little bit, then somebody else and somebody else. So that's if they're living with someone other than a guardian. And then hotel or motel are 31. And those are families, again, who tend to be, maybe they're being put up because of a landlord, because of a fire, because of mold. We've also had families self-pay to stay in a hotel because they've lost their housing. And several years ago, those of you who've been doing this for a while will recall that at one point, a lot of families were being put up in hotels. And yes, they would be sort of, a suite where maybe there was a little kitchenette or something. But what I tell folks is, I don't know about, other people, but, anytime I've gone on vacation with my family, even if it was the happiest place on earth, and you're paying for nice accommodations, it gets really old really quickly. And it's a really, really tough way for families to survive. So those are the kids. What we offer is that, well, first of all, we really suggest and advocate for families to make themselves known to us, that we can't support folks if we don't know they need the support. So when families registered with Worcester Public, there are some questions about homeless, whether you're doubled up. And again, primarily that's doubled up. We know the addresses of the shelters. We know some of the scattered sites, but it's really about information. Sometimes we have, it goes 2 ways. And just to talk a little bit about the school piece. Under McKinney-Vento, if you live in Worcester and you become homeless and you get placed in a shelter, say in Marlborough or Framingham, you are still legally entitled, if the parent wants, they can stay enrolled in Worcester, and Worcester will try to arrange transportation. Now, the limits around transportation are, we really don't like to do it more than an hour for an elementary kid. In the past, we've had kinder kids or preschool kids, and the parent wants to transport them. It's like an hour and 20 minutes. And, when you're going to be on the bus more than you're going to be in school, it probably doesn't make sense. It's more stress inducing than, consistency providing. So we do that. We're also limited by vendors, that there's not a lot of vendors who are available. And if you have a family in a shelter that has 4 kids, but the van going between here and Framingham has 3, how do you figure out who gets a seat on the bus? So we work at that. We can also reimburse parents who may have transportation if they want to drive their child back and forth. We can support that way. Once their kids are in the school, we do provide services. And again, we can, the first thing I encourage families is to get enrolled in Worcester Public. I work very, very closely with the shelters. We also have 2 staff who are dedicated fully to working with homeless families. We have Carol Baez, who anybody who's been doing this for a while knows Carol. She's a tremendous support. And my apologies to Central Mass. We were able to get Luby Bakova to join us 2 years ago. And I still apologize for the loss you have, but she's been an amazing asset for us. 2 years ago under McKinney-Vento, they developed this unique position and it was for housing stability. What happened is, and I think Etel alluded to this, as a school, we know how to support the kids, But the housing world is a completely different world. There are rules, there are and just because you know about housing, you might not know about schools. And just because you know how to support kids through trauma, you don't know the housing world. So Luvi really has been a great bridge to that. She has done that for years. So she works with our families who are in shelters, but also with our doubled up families. We have a partnership with the housing authority and provide workshops for families. We also provide some material needs that we have gift cards. A couple of years ago, we started buying Uber cards because for many of the families, in order to get to a meeting at the school or to bring your kid to practice or to get to the, to their play or different things like that, transportation was an issue. And again, we work a lot with the shelters. We, during when the pandemic first started, I was spent a lot of time in BJ's hunting down diapers and Clorox wipes to get to the families. And also a lot of what we do is the case management, that it's really about helping people access the services. There certainly aren't enough services and supports. However, I feel that in Worcester, we do have more supports than other places. We can help families identify where are the food pantries, where can you get clothing, where can you get, the food that you need. Again, the big issue has been the money around housing, and, sustainable housing is the solution to many of these problems. However, the grant that we have, it's one thing to buy diapers and sneakers so that a kid can play sports. We can't fix the problem of income and sustainability that way. So between Luby and Carol, we work very closely with CMHA and other folks, and we really help parents access what they need. I think a lot of the families who are homeless, again, have had an incredible amount of trauma, have had a lot of instability, and the problem solving, the main problem that homeless families have to solve is how do we stay fed, how do we stay warm, and how do we stay safe? So sort of that long-term planning, that getting, the access to things may not always be there because it's about survival. These families are living in survival mode. And also talking to families and finding out, I worked with a family where, shelter is supposed to be a short-term situation, a family that had 2 babies while in shelter. So that's at least 2 years right there. Families who, they don't even consider themselves homeless because doubled up is how they survive. That's how they roll. You stay with one person until you can't, and then you go somewhere else. So we're really trying to interrupt that cycle, to work with families, to also work with schools to help them understand the dynamics of homelessness. And it's the simple things that if you're doing, thank you for talking about the ACEs, but really being mindful that not every kid has the experience that your kids have had if you're a teacher. So things like, at the beginning of the year, oftentimes, and I see less of this now, which is a good thing, do a timeline. So teachers, well-intended, ask children, do a timeline. Well, things on the timeline aren't always, I got a new brother and we moved to a big house and I got a puppy. That's not the experience that many of our students have. But even things like bringing a baby picture. That's part of when kids are graduating. Oh, we need some baby pictures. Not all families have that. Not all families have, souvenirs from trips they didn't take. Assignments about your house or your neighborhood, things like that. So I do feel that over the years, the teachers in Worcester are very informed and have been, have much more information as far as what the change is. We know who, for the shelters, they tend to go to be enrolled at a couple of schools if the parents choose not to keep them in their school of origin. So, those schools work very closely with the shelters and to support the kids. So again, the big thing is making sure that we know who the families are that need our support. And, it is confidential, and just really to helping them navigate the very unworldly world of sustainable housing. So.
Thank you so much, Maura. Etel put, a compliment of how amazing it is that we have, you dedicated to this. And not only are you here talking to our audience about it, but I know you're at lots of the sort of policy planning tables, lots of the emergency response tables. And again, Etel, really highlighted that so many issues are connected when we're talking about homelessness, right? We're talking about poverty. We're talking about what we have for housing stock available. Yeah, and Parley, thank you so much for being here. I know that this is your space. You're working with people that are homeless, families that are homeless. Brian, I don't know if people had any sort of specific questions for Maura, or if we would want to transition to Brian talking a little bit about what he's seen.
And I'll put my email and my phone in the chat. So the best bet would be to, you can reach out to me and I can put you in contact, especially if it's around things like, hotspots or laptops, things like that. And also too, to make sure that families that you're working with have let the district know what their preference is when we reopen.
Oh, good. Okay. Yeah, that's important. As you said too, I love your really practical advice about asking people about it. Is grandma living with you, or are you living? That's really helpful. And again, we know that it's such a stigmatized identity that people are often not going to come and volunteer and say what's going on. They feel too embarrassed. So for those of us in the community that are working with families, anything we can do to help them connect with people that can help them in the school or wherever that is really a good service.
And thank you for the opportunity to preach to the choir.
Brian, did you want to jump on in and talk a little bit about what you've seen and experienced and what jumps out for you as kind of the biggest issues we should know about?
Yeah, sure. Well, thank you all for being here, and thank you, Amy, for putting this together, and folks that helped. I think Etel did an awesome job of kind of setting the stage and really talking about trauma and families. I am the regional manager for Elliott Community Human Services. I work on a PATH grant, which is a federal grant, and we predominantly work with unaccompanied individuals that are homeless. So we do both street outreach as well as in-reach into shelters throughout Worcester County. My organization, we have 5 teams that are similar to the team that I work on. Our team works in all of Worcester County plus Framingham. So we have a large swath of the Commonwealth, but we do have, Elliott does have another 5 teams doing similar work across the state. The only place that we don't cover is the Cape. So if folks ever have any sort of questions in regards to individual homelessness, unsheltered folks, definitely I'll put my information in the chat box. I'll put my work cell as well as my email address, and definitely give me a call. We do have kind of a narrow view of the folks that we can work with, but I'm always willing to and oftentimes consult with folks about anything having to do with homelessness in the Central Mass region. So I just wanted to touch base on a couple things in regards to individual homelessness, but also just kind of trauma and our role as helping professionals, and how whether we are, I'm a licensed mental health counselor, so that's definitely, doing trauma work is something in a therapeutic way is something that I do in the work that I do, but also just to remind people and let folks know anytime we're engaging with other human beings, we are a helping professional, and we should be doing that in a as trauma informed way as we can. And so just recognizing what trauma does to individuals, and some of the things that I know a lot of people see as behaviors amongst, whether it be children, whether it be adults living in shelters, kids in schools, kids in the community. Oftentimes these are significantly trauma reaction. And this is a result of their experiences. So just wanted to say a couple things. First, this is actually a pretty good segue from talking about children to adults. There aren't a ton of correlations that we have been able to make as a society and as a field about what causes individuals to become homeless as they get older. But we do know that ACE scores, absolutely, as Etel talked about, are very important. And recognizing what people have gone through, and the more adverse childhood experiences as well as traumatic events definitely causes folks to be more likely to be homeless later in life. So really, I appreciate all of the work and the talk, and recognizing that we really need to work with people and recognize their experiences early on, so that they don't end up in a situation where they would be receiving services from myself or other folks in the community. In terms of trauma and re-traumatization, we know that everyone experiences traumatic events in our lives. Does that mean that it reaches the level of having some sort of disorder, whether it be a post-traumatic stress disorder, whether that leads to an ongoing anxiety disorder or major depressive disorder? Not necessarily, but we do know that when anyone has traumatic things that happen to them in their life, our anxiety increases. And we know that with increase in anxiety, we oftentimes have a fight or flight response. So that's something that we consistently see. And that includes when people are re-traumatized, which oftentimes in the situations, whether it be in shelters, whether it be at school, we've talked about those sorts of things, can be very triggering and very traumatic for people. We also know that another way that people deal with trauma and or anxiety is shutting down. And so just not able to answer a question, not able to engage. And oftentimes I know people can get very frustrated and see this as, you're just choosing, you're making a choice to not answer my question directly. When we know, thinking about engagement and kind of mental health concerns and mental health issues, that this isn't a conscious decision that someone is making at that moment. So just really being mindful of, and really, I try whenever I'm talking to folks, I also, really try to start at a place of universal precautions, just like we do with medical care. My assumption is that whoever I'm engaging with has had significant traumatic events that have happened in their life. So I'm going to start there. I'm going to start with, as people say, with kid gloves on. You don't want to, these are folks who have had significant issues with authority figures, with the justice system, with parents, with caregivers, with landlords. So really starting at that place where you're going to be kind and recognize that you don't know what this person's experience has been, and it's their opportunity, it's your opportunity to connect with that person, to really have a trusting relationship with that person to where they feel comfortable sharing with you. So in order, we can't force people into, especially when we are authority figures for so many people. We work at organizations that people are coming to us for help. And so really just want to remind folks of that we want to be as kind and gentle, and we want to be able to try to form relationships with people so that we have positive outcomes for them, but it also makes our work a whole lot easier. Another aspect, or just something about that, is that oftentimes when people are stressed out, whether we're talking about the general public or we're talking about folks that are homeless, is that when we get stressed out, there are oftentimes really unhealthy coping strategies that we utilize. So when we see someone that is homeless, that's unsheltered, and where they're drinking every day, and they're not in a place where they're able to stop, yet they say, I know this is not good for me. It is not, again, it's not a personal choice. It's not a failure of how strong the person is mentally. It has a lot to do, and I would say most to do, with the situation that they're in and the experiences they've had. I know I oftentimes say that if I were in a situation, whether staying at an emergency shelter or unsheltered, I'm sure that I would have many more unhealthy coping strategies that I would have to utilize to kind of dampen down how tough life actually is, and to not feel all of the feelings of the experiences that I've had and that I'm continuing to have. So, I know people oftentimes say try to walk in someone else's shoes. I think just being there and allowing that person to tell you their experience. It's not our place to judge, to make judgments, to push people into what we believe is best for them. We know that pushing people into substance abuse treatment, we know that pushing people into mental health treatment does not end in a positive way. We all do have agency. We all do have our own abilities. And we are the ones that need to make those decisions. So I see our job, my job as a community member, as a parent, as a neighbor, to be there and to be supportive and to help people with whatever it is they're looking to do and whatever it is they want to do. Something that that I like to talk about that is really hard to put into place, but whether we're talking about family shelters, emergency shelters, we really want to do our best to create kind of a psychologically informed environment. So basically what that means is that we want to do our best to kind of limit the chaos. We want to let people know what to expect and when to expect it, even if those things are hard to say. But we don't want to tell people, for example, something that I see over and over again in the field is people giving workers giving folks that we are working with a false sense of security, and saying, okay, and this is what people need. This is what people want, is an answer to a question. How long will I be in shelter? How long until I get housing? One of the worst things, in my opinion, that we can do to someone that has been traumatized by the system, by the community, by family members and loved ones, is tell them something that is not true. So as much as folks want us to say, this is going to take 2 months, and they'll even say, it doesn't matter how long, I just want to know. I think it's doing folks a very big disservice and is re-traumatizing because it's doing the same thing that everyone else has done for those individuals in their life, which is, I'm going to tell you what you want to hear. It makes me feel better because I'm done with the conversation. You feel better because now you have a date. And then the relationship goes to shit, frankly, because when you can't follow through on that, now they no longer trust you. And you're just another in a long line of people that have traumatized this family or this individual and this human. I see Amy beat me to the punch in terms of the next thing I was going to say. So schedules and routine is really important. People feel safer when they know what to expect. I would add having clear boundaries is really important as well. Not boundaries or rules in a punitive way, but in a way that people know what to expect and know that you're keeping an eye out for them and their safety and the safety of other folks, and that you're not going to, allow people to engage in unsafe behaviors and that things are just going to be utter chaos, and you're going to just be responding to the crises and not helping the folks who are sitting over in the corner who are shutting down as oftentimes as a result of the chaos and the trauma that's going on around them. I would say clean and orderly physical environments is really important and is hard. Etel spoke to that in terms of a lot of shelters are in old buildings, but doing our best to make things homey, to allow people to make their space their home in that given time. And I know it can be hard. We don't want and we can't have people bringing everything that they own from storage, but definitely allowing people to bring in transitional objects, bring in things that are important to them, and making sure that they have a space for that. Is so important, and I feel like goes a really long way with connecting with people and letting them know that you're there for them and that you see them as a human being, and that this is a transition. This is a tough time in their life, but it is a transition that they're going through, and that you're going to be there to help them through that. The last thing in terms of just the environment stuff that is really important, and I think everything that I'm saying, I would say is important, whether it's with your own family, in your home, whether there's a traumatic event happening outside, in the community, or you're in a shelter. But I think it's really important to do our best to, when there is some traumatic event happening, and there's someone that is really triggering folks all around them, to try to get that person out of that environment. And it definitely limits the chaos and the trauma for everyone else. But if that is not possible because that person is in such a state that they can't be connected with, it's okay to move other folks away. It's okay to see who is being most triggered or most affected by that situation and pulling them out of that situation so that they no longer have to face whatever that trauma is. And that could be done, at a shelter with, 50 people sitting in the shelter. And if you can't get one person out to say, hey, everybody else, let's come over here. Let's go over here. Let's try to figure out what we can do over here while this is going on. So just being mindful of your environment, of your space, and recognizing that just because someone, like I said earlier, just because someone is sitting in the corner being quiet, that person oftentimes is being just as affected as the other folks who are in the environment who might be voicing that they're really triggered by this person. So just being aware, just observing your surroundings, and trying our best to limit that chaos and make those sorts of things happen as quick as possible. Another thing that we hadn't touched on, but I did want to touch on, is the trauma that we all potentially can experience as caregivers, as workers. So not going to go full blown into a trauma-informed care training mode, but just a couple of highlights, that, direct trauma responses from seeing traumatic events very much can affect us as caregivers, as parents, as other human beings. And so when we have those experiences, we really want to slow it down and take a look at that. It's not a sign of weakness by any means. Debriefing, even when you don't think you need to sit down and talk after a traumatic event, is very important. I find it's a really good way to learn more about you and your team and the other folks that are around you, which will be really helpful in the future, because another traumatic event is going to happen. For most of us that are living in the world that we live in now, I want to, and especially in work environments, I want to know who is the person that I can call on to get people out of a situation while I'm dealing with whatever the main focus of the situation is. I know that typically I'm someone that likes to get right in the middle. And I feel like that's something that I've between working in residential treatment and working with chronically homeless folks for a very long time, I have learned that that's something that I typically do. But I know that one of my coworkers, the way that they deal with those situations is they kind of freeze. And so through debriefing and talking about those things, I know next time to say, hey, can you grab this person? Can you deal with the front door? Can you deal with something away from that traumatic event, so that I can try to calm down this other situation? So that's direct trauma. Also would just say, EAP, it's not, again, therapy and EAP is not a sign of weakness. If we're going to continue to do this work and we're going to be effective and we want to continue to like our jobs, which I hope most of us do, then there are going to be times in our lives that we're going to need or should be in some sort of behavioral health treatment. Whether that is short-term dealing with something that's going on, or that's long-term dealing with trauma that you have experienced and ongoing trauma that's going on. So just a little plug, a little reminder for folks that is something that is very important. And starting with EAP is always a good thing. Typically it's short term. It's a little bit, in my experience, folks, I know when prior to me ever starting behavioral health treatment, I had utilized EAP. It was a little less stigmatizing. For me, I felt like it was a little easier for me to make that phone call, and then was able to recognize, hey, there's some other stuff that I could continue to work through that would be helpful for me in the work that I do for the people that we serve. Also, just a plug or a reminder that there's also secondary or vicarious trauma, which is, simply can come with a ton of the exact same symptoms as having direct trauma and or PTSD. But that's really from hearing about the ongoing trauma that people have experienced and hearing those stories, which we all hear, whether it be from the kids at schools, whether it be from adults that are talking to us about things that have happened to them in the past. And that can be grating, and that can be really tough and emotionally hard for us to continue to hear those things, and can cause you to to definitely have heightened anxiety, heightened awareness, hypervigilance, all of the things that we typically see in any sort of trauma reaction. So I would say, even if it's not a traumatic event that happens, still be aware of those sorts of, be aware of the stuff that we're taking on from other people, and that we're hearing, and that oftentimes we're carrying with us from a day on a daily basis, and utilize those same supports. Utilize those supports of EAP, behavioral health treatment, supportive supervisors. And the last thing that I would like to say is really in terms of the agency that we are either representing, working for, or working with, is making sure that your supervisor, or that your supervisees, if you're running an agency, have had some training in trauma-informed supervision. It is not, we talk a ton in the field, in a lot of agencies, about self-care and how do we take care of ourselves. Which is really important. That's important stuff, but that puts the onus on the individual. That puts the onus on me as a person. And frankly, as someone who has been doing this work for a long time, our organizations are the businesses that we work for, the school systems, the municipalities. It is our responsibility to also support our and to support our employees, and to really help them to get whatever it is that they need, and for us to create an environment, again, that's psychologically informed, that is supportive of the work that folks out there on the front lines are actually doing every day. So there's a ton of information out there on trauma-informed supervision. There's forms that are really helpful in terms of structuring supervisions. But just wanted to finish my part with the fact that I do think that it's important for organizations and folks who are in leadership roles to really be there to support the people that we're working with, to support our team members, and do whatever it is we can to make sure that we're all doing the best that we can to help each other, as well as the folks that we're providing service to. I think next we're going to turn it over to Etel.
And Brian, that was so amazing. I can see why people have been saying for so many years, how do you not know Brian? Because same soapboxes. I love that you talked about just the importance of taking care of yourself, and that you don't have to be a licensed mental health person to be helpful and supportive. That's one of the things that I often try to say is, people feel like I don't have the skill set to do this, but really the skill set is listening and caring, being authentic, being trustworthy, all the things that you just said. So I love that you really brought that home. And certainly thinking about mental health, we know I had a student at Worcester State who did like a homeless simulation for us. And I thought I was pretty good at my empathy until that. And then that evening, oh my God, that was so hard. We did it in November. I had my son with me. And just seeing pretty clearly how you didn't eat, so you're real miserable. You didn't sleep, so you're real miserable. I know for my own mental health, if I haven't eaten or slept regularly, forget about it. And if that's my new norm of being in shelter, being homeless, I can't even imagine how people can maintain reasonable mental health, let alone make mental health improvements in those situations. So the sensitivity piece, I think, is just so big. It's so important for us to be aware that people really are doing the best that they can. And if it doesn't look that great to us, call on your empathy, because they really are. And I know we have other people in the audience that have done this work. And again, Etel, I always appreciate your intersectional analysis, that you remind us about the intersections of racism and sexism and poverty and ableism and all of the pieces that are not individual factors. They're bigger, much bigger social factors that have people in these situations. Are there questions people have or things that didn't get answered or responded to for any of our presenters? People, you can jump right in and unmute yourself if you'd like at this point.
I have a question, Amy.
All right.
So a great presentation, everybody. That was just simply amazing. The amount of information we just got was just unbelievable. But I guess I go away from every single event or presentation I ever go to asking the same thing, and it's where do we go from here? I mean, there are a lot of great heads in this space right now, and I'm going to go on a limb and pick on the city, because I don't think that the city necessarily is paying as much attention to this issue as they should. And I'll be the first to say that I don't need a ballpark. I need to make sure that there's not one single person in the city living on the street. And so if we're going to build a ballpark, we're falling short. So what can we do now with all this information going forward to make some change, besides getting Etel into District 5 and a few other people selectively around the city? You know, what really can we do?
Anybody want to grab that? Joanne had put in the chat too, are there policies we can advocate for? What can we do as just people concerned, but not directly working with the homeless? How can we be supportive of your work?
Yeah, was that Bill who spoke? I couldn't tell.
Yes.
Yeah.
Thank you, Bill, for that. I think that there are some things that from the legislative point of view we can do. In actuality, I'm working with to put a legislative briefing in place in late March, potentially beginning of April, to lay out some of the priorities, local and state priorities. Definitely affordable housing is one of them. There's legislation at the State House that's looking at different things, whether that's increasing the amount of rental assistance. We're working diligently to, meaning Central Mass Housing Alliance, but also all of our partners, Brian, Parley, anyone that's in that provider universe. We're trying to figure out too, in our city, where are the areas and the zip codes and neighborhoods that are mostly struggling, so we can target some specific assistance and get the word out. I think from a policy level, there's an affordable housing trust fund that the city manager has promised to the community. My understanding is that that's coming up. It's probably going to come up on council very soon, either in February or March. It's important that we ask questions. How is this affordable housing trust fund? Who will oversee it? Are the folks that are going to be commissioned to be appointed to oversee it? Are they going to ask some hard questions about where are the areas that most need housing production? How much housing production is the city of Worcester putting for families that I know Brian and I have talked about this, and others, Parley was just here, for folks targeted specifically for the really most vulnerable members of our community. You know, we talk about workforce housing is not nearly affordable to the folks that we're talking about that are, you know, so I think from a policy perspective, my dream would be to have a family commission on family homelessness. We have the coordinating council that specifically is looking at the chronically homeless individuals. There's some pieces of work being moved there. The city of Boston, just by ordinance, by virtue of a city councilor, really pounding the idea that we actually need to look at family homelessness, because it's an issue that we just cannot ignore. And she was able to get a family homelessness commission to look at the schools, the DCF, the department, DTA, bringing multiple partners to look at the data, study the data, and then recommend policy solutions that are data informed with an equity lens. Can we do that in Worcester? We have so many people here that have so much experience in this area, that have lived experience. And I do want to put in a plug that we need to do a better job at centering folks with lived experience, because they are the experts. Yes, Brian and I and Amy and those of you who work in the field, we understand the stories and we bring them out in advocacy, but it's ultimately the folks who have to put their head on the pillow at night, wondering if they're going to have a meal or a safe place to live, then know what's best for them and their families. And so if we're able to have a more uniform understanding of family homelessness, of homelessness in general, who it affects, why, then we can devise policy solutions. I do want to say that not everything depends on our city. So, we're bound by federal resources and policies. We're also bound by state. So being able to have that continuum where we advocate for both or all, I think is important. But absolutely, that should be a priority of ours, that not one single child has to wonder why, they don't have a safe home to live. So that's just my emotional plea to your question.
I would also add, Etel did an amazing job, as she always does, of talking about policy and kind of the macro. What can we do? Which we need to do these things. We need the money. We need the resources. We need the data to do all of these things. But I like to also just remind folks that on the micro, there's some really important things we can do in terms of folks who have been traumatized and folks who are living on the margins and are not feeling accepted or treated well by other folks in our society. And I would say, you see folks that are on the street holding signs, those sorts of things. I never get into kind of an argument or a conversation with people about what you might feel comfortable doing for someone who might approach you, or even judging or saying what is good. Do you give money? Do you not give money? That opens up this whole can of worms. And I know we all have different comfort levels. The one thing I would say is acknowledge people, look someone in the eye, smile, wave, say, I hope you have a good day. I know not everyone feels comfortable doing that, and there are lots of ways, lots of reasons that people might not feel comfortable directly engaging with someone. But as we're driving by, as you're driving off, say hi, say hello. That goes a long way for someone who's been standing out in the cold, being treated like crap, because they're one of those people, because they're not working, all the things that we know. So I think just engaging with our fellow human beings in as kind a way as we can goes a really long way for solidifying for these folks that people in the community do care, and that they are a human, and that they should be treated with dignity and respect, just like anyone else.
Thank you. That was awesome.
Thank you.
I think that is the invisibility of the problem, I think, has been sort of surfaced a couple times. Like, we don't want to look at it. We prefer to look away. When it's youth homelessness, we're not told about it. People don't disclose to you, don't share. So I really appreciate that reminder. Like, don't pretend it's not happening. It's a lot more comfortable to pretend it's not happening, but that is really not helping. That's really adding to the problem when we don't want to see it.
Amy, I wanted to add one more thing, that when we think locally of things that can make a family's or an individual's life easier, in terms, like we think, like Brian is right, we think of people as whole and not separate. And families are whole entities, and an individual has multiple aspects that they need to piece together in order to become stably housed. And so, like, there are things that we're talking about, public transportation. Well, as you saw, in one of the things in that study was that oftentimes folks living in poverty cannot afford to have a car. My family's at the shelter cannot afford to have a car. There's no place for many of them to have a car. We have a small, sometimes they can't bring their cars with them. So how is that one supposed to find jobs that are above minimum paying if they need to travel from place to place? Well, public transit becomes an important part. Well, people say, 50 cents or $1 is not enough. Well, have you ever been poor and having to count dimes? Because even finding the right change to get into the bus is actually a hassle. And so there are things that are happening right now, and the conversation around public transit is one, the conversation around projects that come into the city and the jobs that they provide for our residents is another one, right? Housing production is one piece, healthy housing production, but we also need to think of people as living wholesome lives, and decreasing that housing income gap is a huge piece of the puzzle. So just putting a plug in for some things that are happening locally that we could also advocate for.
Thank you. We also know that trauma is generational. People talked about it a little bit without necessarily being that direct about it. But if you're a kid and you're living homeless, that's what's normal for you, right? So why on earth would all of a sudden you have this? I think a lot of times we expect people to somehow know what's expected of them or somehow have the skills to do the things we want from them, but we're not I don't know where that would have happened, right? We often see, especially in child welfare, that people were themselves in the child welfare system, and then they go on to become parents, and they weren't adequately parented. How on earth do we expect them to suddenly, because they had a baby, become good parents? It's just, even hearing about some of the things that we expect for people that are experiencing homelessness, they have to call, they have to fill out an application, they have to do this online. It just really, it's easy to see how many barriers people face and how quickly you could just feel like you're drowning in this. Yeah, the downer thing. Sorry, I'm looking, okay, how can we, hey, maybe we do have just maybe a minute or two. Etel, Brian, anyone, a success, anything that really makes you feel like, I'm so glad I do this work, or can you give us a warm fuzzy to wrap it up?
Well, I think what, as I was putting these things together, right? My heart was in my throat, it's just sad to know that we have so many people struggling. I think what's really helpful to me and to know is that there's so many of us who are diligently working behind the scenes, advocating at the state level, federal level. We're pushing and pushing and pushing and doing the daily work of supporting our families and anybody who struggles. And for me, that means that those of us who are doing that can bring others along to break the stereotype, to break the idea that there isn't enough. There is enough. It's just we're choosing sometimes not to put the priorities where they match and align with our moral obligation that nobody in our community should should be homeless or struggle with hunger. So that's my hope, is that there's many of us who are doing that work, and hopefully more will join.
That was beautiful. Thank you. Well, all right, then we're right at 2:00. Again, thanks so much to everyone who tuned in. Thank you to Brian and Maura and Etel. That was amazing. So much information, so much usable information. We're really, really grateful for the work you're doing with clearly the people that need the most help. And hopefully, we can do more to support you as a community in the work you're doing. Thank you so much.
Thank you all for being here.
Thank you so much. That was a great training. Thank you.
Thank you to everybody.
All right, thanks again. We'll post the recording when it's available. People can share it with their staff, watch it again, all of that good stuff. Angel. Great. All right. Thanks again, everybody.